I'm very sorry for my voice due to a severe cold, but it's a perfect time to deliver a hot topic. And the hot topic is the one of the opening of the VIA Registry, a unique global real-world data collector around which all the VIA Indonesia World Congress will be focused, for which exactly 6 months from today we'll be together discussing on these important topics that really are in the most actual literature, as per the references you reported over here, pointing out the need of filling the gap, of bridging the unmet needs of the difference between clinical trials and real-world data generation. In this sense, VIA Registry could really represent a solution considering the detailed analysis we have been running in the last months, particularly taking care of avoiding specific flaws and biases. The topic, as I was saying, is extremely hot because if you read in the literature, you see and you read statements like treatment decisions will be by necessity made from a combination of randomized comparative trials and real-world evidence. So let's make sure that, first of all, we speak all the same language, following the proper definitions, in this case from FDA, mentioning a clinical trial as a research study in which one or more human subjects are prospectively assigned to one or more interventions, compared to real-world data in which we are talking about the patient health status and or the delivery of healthcare routinely collected from a variety of sources, among which the registry really represent a pillar. I greatly enjoyed the publication of Wang and colleague of the RCT Duplicate Initiative, where they basically looked at 32 different randomized comparative trials and compared them with an analogous data collection in similar settings. What they concluded is that real-world evidence can reach similar conclusion as randomized comparative trials, but just when design and measurements can be closely emulated, which is a fact that is not easy to obtain. And indeed, emulation differences, chances, and the residual confounding vectors can contribute to these divergence. And you clearly see that in the different colors of these two columns, with not that much overlapping between randomized comparative trials and the real-world evidence. This means that we have an internal validity that is the one inside, let's say, our scientific house of a clinical trial with a specific population, compared to the real-world evidence that is the external validity of the outside world, what is happening outside our windows that are containing our house of evidence-based data produced by clinical trials. This is clearly evident in an age of humanity in which we have so many sources of health data, like electronic health records, medical claims data, of course, registries, and I said, and the different wearable technologies. All of this is allowing us to significantly grow in the understanding of the diseases and of the best management of this condition. Indeed, this real-world data generation has been associated with the possibility of looking at the medical product development, post-market surveillance, influencing the regulatory aspects, and also guidelines development. This is clearly evident in publications that are mentioning real-world data is able to transform the understanding of population health dynamics and at the same time the ability to forecast health trends. Very, very strong statements that are already present, because indeed real-world data are already guiding strategic decision-making. They are giving us information about the disease prevalence and incidence. They are predicting the scope of potential patient populations, and they are helping us also optimizing study designs to make sure that they are as close as possible to the external validity of which I was talking before, and at the same time help us managing the post-market surveillance in terms of safety and also efficacy. This is evident in graphs like these ones, reporting the number of publications dedicated to this topic, not just in one country, but as we can see from this figure got by the same publications reported over here, really a global phenomenon. So not just some countries, and indeed it's not by coincidence, it's not just FDA, but also EMA and NICE took actions in this sense in 2018 with FDA creating a framework for real-world evidence program. In 2018, again, with the EMA for a discussion paper on patient disease registry for regulatory, and I stress out regulatory purposes, and NICE in 2022 for the use of real-world evidence for health technology assessment. So the importance also, again, of the monitoring of the post-market surveillance. Clearly, the registries are a pillar in this process, as it is clearly reported in this figure. That is pointing out the potential flaws also of the registries, for which we have to be sure we are using the appropriate one, built in the proper way, with analytical methods that can reduce at minimum the potential biases and confounders, including also the fact that there is no randomization. In this sense, the first thing we have to do, in our opinion, as in medicine, is create no harm. So make sure that the data are protected in the proper way. There is a balance indeed between the personal privacy and the advancement of healthcare. But at the same time, we know of the constant threat of the health data breach, for which we have to be cautious, knowing, as per this graph, there has been a constant increase in the attempt also of creating on purpose these breaches, for which the GDPR is helping us in a very strict way in the countries you see in red, in a milder way in the other countries with other colors, even if there are peculiarities for which, if you're covered for the red ones, it does not mean that you're covered for the yellow or green one. And that's what we also took care about in these last months, for which I deeply thank the lawyers who have assisted us. It has been an extremely interesting cultural experience for our group of healthcare professionals to co-work with the legal experts to make sure we are doing things properly. Another major issue you can find in the creation of registries and real-world data generation is the feasibility of the tool per se, because of course it's interesting to create a list of data we want to collect from the patient, but the patient has its own time, as the healthcare professional has its own time, which means that we found a way to bypass the time issue, allowing legally the patient to give data to his or her own healthcare professional even before the visit starts, thanks to a dedicated software with a protection of the shared data, so that in this way we can maximize the information even before the patient comes to our office. Another interesting point is the one of the ethnicity. When we are doing registries, we should not limit them to some groups, some nations, but we should really go global nowadays, considering also the globalization phenomenon, for which also this aspect was considering the creation of the registry, thanks to the multilingual approach we had, and to the involvement of the legal experts for making sure that all the world can speak the same legal language inside the platform. I really like this statement by Adrian that is talking about building continents of knowledge in oceans of data. In this, I am extremely grateful to all the WIN team workers, not just healthcare professionals, but also the other experts, from the software experts and the legal experts and all the other ones involved in a group effort that is allowing us a huge community that is open to the world, to have other ones joining in collecting real-world data together in a proper way. So let me show you how it works and the uniqueness of this project. As I said before, I would say that the first aspect to mention is the possibility to connect with the patient even before the patients come to the visit. I tell you by my own experience, this has been extremely already appreciated by my patients, because even before seeing me, they have already the possibility of giving information, so that by the time they're in front of me in the office, we already know a little bit each other, and we can maximize the value of the time spent together and the amount of information shared. The registry is fast, because indeed all the patient's part has been done already before coming to you, and then there is a backbone of data that are very quick in their filling in, so that this will not hamper your everyday practice. If you will be interested in having extra data collection on specific topic, you can branch out, creating dedicated data collections and inviting other colleagues to collect the same data with you, so that indeed, as per the line of this project, we move together forward. All healthcare professionals indeed together, not just physicians, but also nurses and also technicians rather than physiotherapists, for example, all the ones who are allowed to visit a patient can take part in this global effort in terms of scientific advancement. And really everybody in terms of continents and in terms of languages, because we are already out in several different languages and more are to come. And particularly if you're interested, feel free to reach out so that we can eventually add your languages as well. But even more important, I would say, so last but not least, as I said before, compliant with international laws and already IRB approved as a project, for which extremely seriousness has been put in this project that is now available at the registry.com website. So allow me to give you a little bit of a tour inside. So you will just click on the join button so that you can read that you're welcome to join by clicking on the apply for the registry membership. This is for free. There is nothing, of course, to pay. If not, attention in choosing the language you want. So select the language you prefer, and then you can fill in your data as a healthcare professional and apply for becoming one of the data collectors of this large community. Once you have done that, you will be able to upload your patients. And once you have uploaded your patients, clicking on the patient, you can send the patient an invitation by mail with a unique code to fill in the data. And in this sense, you will be the only one knowing who the patient is, because the patient will be immediately de-identified. So you will be able to follow that specific person by name and surname, while all the other ones will follow the person by an individual code that is totally de-identified. The patient will fill in different data that are allowing us to remove all those biases usually present in the epidemiology, in particular data collection of chronic venous disease. These data will be validated only in the moment in which the patient will come to you in person, so that you will visit the patient, you will check on the patient, and you will confirm that the data are of course reliable. Say that I'm writing, for example, that I'm curly blonde. Clearly, this is unfortunately for me not true, which means that you will ask me if maybe I had a typo, you will correct it, and then you validate the data. Once you validate the data, you can fill in with your data. There are very few in the backbone part, including also ultrasound informations and signs and symptoms, the kind of therapy you assign to the patient. And we really cared also about the setting of the vein and lymphatic care, and also the waiting time before the procedure. So there are also some healthcare, let's say, socioeconomic aspects that we included, so that we can manage at best the condition in every single aspect. So after this, your time dedicated to this is over, so really few minutes, but you will be able, if you would like, to add customized data collection. So you can just click on creating other questionnaires for your patients, so that together or alone or with whoever you want, we can collect worldwide specific data and follow them up eventually in case we are interested. So summing up, we are talking about a registry that is focusing on geographical and race epidemiology, with also an attention toward natural history of the disease and an attention toward the safety, clinical, and cost effectiveness of healthcare products and services, quality of care, and quality of life impact. These are terminologies that are used in the registries, for which they are not by chance reported over here. When I'm talking, for example, a health service registry, as the registry is, I'm talking about a registry dedicated to clinical exposition, as indeed for this project. Same for the product registry type, because we will be looking also at devices, compression, drugs, and so on. And also a condition registry, because this will include comorbidities data that will help us understanding the impact of venous and lymphatic disease, not just at the leg or the upper limb level, but of course at the systemic level. With this, I will conclude with a huge thank you in all the languages to all the ones involved in the creation of this massive project, starting in this case, considering the huge work done with the software expert and with the legal experts who really impressed me with their skills and knowledge, for which they will be invited also with dedicated lectures on this important topic of the proper health data management and use and dissemination. Just as a note, thanks to their excellent work, not only we are available in the countries with the normal European GDPR that you see over here in red, but also in countries like Russia or China, where there are specific regulation for which, thanks to also the collaboration with colleagues involved in the area, and for this I would like to deeply thank also Professor Chi for being extremely instrumental in this aspect, together with all the other aspects of the foundation, together of course also with Professor Bottini and all the many other ones involved. I'm really happy to announce that really this project is now open to the world, so feel free to reach out. There will be benefits for the one who will like to join. In particular, there will be a free registration to all of the WIN events, starting from the one in Indonesia. There will be the possibility to present the data that have been collected, and at the same time, there will be the possibility to extract in a de-identified way the data from all of the groups, so that indeed, as I said, we can move together forward, in this case, toward the BIW Indonesia World Congress. So this will be the meeting room that is where the G20 happened. So a very important, serious room where delivering very important and serious projects like this one, and like the data you will like eventually to collect and present. I really thank all the ones involved around the world, as per this map that is summing up the different events and many other to come involved in this BIW Indonesia synergy, that will also have a touch of humanitarian action in the 2 days before the Congress, when we'll be all together providing first-hand, really hands-on experience for our patients in need of special assistance, because also in economic distress, while enjoying the following days of great collaboration with the local society, the Indonesian Venous Forum, and all the group of the Indonesian colleagues, and all the world who will join us there, for which we really look forward to move together forward toward Indonesia and toward proper real-world data generation. Thank you, and I remain at your disposal. Ciao.